Hello, everyone. Welcome back to FunDERMentals with Dr. Adaobi Obasi. I'm a physician scientist board certified in dermatology and dermatopathology. Today, I'm going to describe the three most common skin cancers. Skin cancers are when genetics as well as environmental factors trigger abnormal cells to form in the skin and result in neoplasms, which are new growths. Neo for new, plasm for growth. Environmental factors that can trigger skin cancer include most commonly ultraviolet light exposure, but also some toxic chemicals in the environment over time can trigger skin cancer formation by inciting DNA damage. The skin is very resilient in repairing itself after DNA damage. However, over time or with enough of an injury or a trigger, the DNA damage can overwhelm the repair apparatus or the repair mechanism, and then abnormal cells form and acquire abnormal tendencies, such as to leave the location that they're in and enter the blood vessel and move to other sites of the body. This feature is called metastasis, and the invasion of the blood vessels to flow to other parts of the body is called angioinvasion. The good news is that most skin cancers are caught early because the skin is one of the most visible organs of the body. So new growths are usually brought to the attention of the physician or the healthcare provider and results in skin biopsies being done to best diagnose them. Check out my video on skin biopsy techniques most commonly done by dermatologists. The three most common skin cancers to be discussed in this video are the basal cell cancer, the squamous cell cancer, and melanoma. The basal cell cancer is the most common cancer in the body. It is more directly related to sun exposure over many years and shows up as a pearly looking smooth bump on sun-exposed areas. It can also show up looking like a rash on the skin that doesn't go away with typical treatments. There are different types of basal cell cancers. There are the superficial basal cell cancer, which tends to look more like a rash on the skin, as well as the nodular basal cell cancer that tends to look like that pearly bump with a central ulcer that I described earlier. And finally, a basal cell cancer can look like a scar of which there's no origin, and this is called morphiiform or infiltrative basal cell cancer. The good news is that basal cell cancers tend to grow slowly. However, depending on the subtype, they may be more aggressive and grow and start to infiltrate deeper into the skin and cause significant damage to different structures on the skin. Basal cell cancers occur when the cells of the basal layer of the epidermis, which is the bottommost layer of the skin, have DNA damage that then trigger abnormal cell function and structure. As I described, the most common culprit is the ultraviolet light exposure from the sun over many years. There are some genetic tendencies to form basal cell cancers as well, called the basal cell nevus syndrome. Basal cell cancers can effectively be treated when they're caught early and completely excised using the excisional biopsy I described in the previous video. The link of the video will be listed below. You can check it out right here. When a growth is suspected to be a basal cell cancer, usually it is sampled or biopsied to verify or to confirm the diagnosis. After the biopsy, which is usually a shave biopsy technique, sometimes a punch biopsy technique, depending on how deep the basal cell cancer appears to be, such as the scar or morphiiform basal cell cancer. The next skin cancer that I'll be discussing today is called the squamous cell cancer. The squamous cell cancer is the second most common skin cancer and tends to be a little bit more aggressive than the basal cell cancer. The squamous cell cancer occurs when cells in the epidermis, which is the topmost layer of the skin, get enough DNA damage to trigger abnormal cell formation in the full length of the epidermis. And then these cells can continue to grow and eventually invade. So there is squamous cell cancer in situ, which is when the cells are limited to that top layer of the epidermis. And then there's squamous cell cancer invasive, which is when those cells extend deeper into the epidermis and into the dermis. Extending into the dermis is an aggressive feature, the second layer of skin, because it contains blood vessels and nerves, and invasive squamous cell cancers can sometimes get into those blood vessels, angioinvasion as I described earlier, or wrap around the nerve, what we call perineural invasion, which enables them to track away from the skin to other parts of the body. There are different ways that squamous cell cancers can present on the skin. They usually present as rough, hardened growths that are usually pink at the base on sun-exposed areas of the skin. And they can be preceded by a precancerous growth called an actinic keratosis, which tends to be a flaky pink bump that usually gets scratched off by patients and always tends to recur. And this occurs on sun-exposed areas. Squamous cell cancers can also occur in other parts of the body, including the lungs, the throat, and inside the mouth. Chronic exposure to ultraviolet light, as well as chronic exposure to toxins, and chronic trauma or ulceration of the skin can result in the squamous cell cancer subtype of skin cancer. There are some skin conditions which, if untreated and left for a long period of time, can increase risk of formation of skin cancers, specifically the squamous cell cancer. In addition, patients that receive organ transplants and are chronically immunosuppressed with their medication to help them keep their transplant have an increased risk of developing skin cancers, including squamous cell cancers, over time. The risk increases over time. Squamous cell cancers can also be caused by cancer-causing human papillomaviruses. HPV, or human papillomavirus 16 and 18, are two of the most common causes of genital cancers in humans, and they tend to cause cervical cancer, vulvar cancers, penile cancers, and anal cancers. They are sometimes described as high-grade intraepithelial lesions. Other HPV, or human papillomaviruses, don't cause cancers. They may just cause benign warts called condyloma acuminatum. Check out my video describing different genital bumps where I go into more details on condylomas. The third and final skin cancer that I'm going to describe today is called melanoma. Melanoma is a cancer of the melanocytes, which are the pigment-making cells in the skin. Melanocytes are usually located at the bottommost layer of the epidermis, called the basal layer. As you may recall, the basal layer is also the location of the keratinocytes, or the skin cells that form the basal cell cancer. For this reason, melanocytes produce pigments called melanin. There's pheomelanin, which is reddish orange, and eumelanin, which is brown black. And these are transported through their dendrites or tentacles to protect cells of the basal layer from ultraviolet light, because those cells are much more prone to developing skin cancers. There are different subtypes of melanoma depending on the intensity of the sun exposure, the chronic nature of the sun exposure, chronic trauma, because there are melanomas that can occur in different parts of the body not related to sun exposure, such as the bottom of the foot, inside the mouth, in the eye, in the genital region. So I plan on discussing melanoma on its own in another video in more depth. Melanomas can be in situ, meaning limited to the top layer of skin called the epidermis. Those tend to be less aggressive. However, melanomas can invade into the second layer of skin called the dermis and beyond the skin to distant organs, including the brain, the lungs, even the gallbladder, the liver. The ability for melanoma to invade is one of the reasons that it's a very aggressive cancer of the skin. The depth of invasion of melanoma into the dermis, called the Breslow thickness, is a key predictor of how aggressive the melanoma is, as well as the survival of the patient. So the shorter or the smaller the Breslow thickness is, the less aggressive and the more positive the outcome is for the patient. However, the deeper it is, unfortunately, it results in a poor survival, as well as more aggressive melanoma that tends to move to distant sites. One of the first things that happen as melanoma leaves the skin is it goes to a lymph node. And then from the lymph node, it goes to distant organs. In all cancers of the body, early detection is key, and that's especially important for skin cancers. The fortunate thing about skin cancers is that the skin, as the largest organ of the body, is easily visualized. And therefore, it's easy for skin checks to be performed to catch abnormal neoplasms or new growths on the skin before they start to get larger and invade. So I don't ever task my patients with diagnosing themselves. I only ask patients to be aware of any new or changing growths on their skin. Do not be concerned of it being cancerous or not. Just bring it to the attention of a clinician, especially a dermatologist, that can best manage this, specifically by evaluating it with different techniques, including dermoscopy, visually, palpating, and then, if needed, doing a biopsy to send for analysis and for diagnosis. I recommend all patients have a routine total body skin exam where a trained dermatologist or clinician reviews the skin from top to bottom, looking at growths that are currently on the skin and evaluating growths that may be changing or looking abnormal. This can be done every year depending on your history. If you've had skin cancers before, it may be done more frequently. I also recommend patients evaluate their own skin every 2 to 3 months to find things early that are new or changing. That is the biggest help that can be done for detecting skin cancers. I'm sure a lot of people are aware of the A, B, C, D, E's of melanoma. A being asymmetry, which can be a feature of melanoma. B being border irregularity, which can also be a feature of melanoma. C being color variation, which can be a feature of melanoma, where you may see dark brown, light brown, whitish color, bluish color, reddish color in a lesion. D being diameter, meaning growth in size. And then E, which to me is one of the most important features to look for skin cancers, especially melanoma, is evolution. Changing of a skin lesion doesn't automatically make a cancer, but it's a good trigger for you to get it evaluated and possibly biopsied. There are situations where growths that don't meet any of these criteria end up being melanoma. And there are other situations where growths meet all of these criteria and end up not being melanoma. It is a little bit challenging, but with the help of a dermatologist, you may be able to decrease your risk of skin cancer formation through prevention by using sunscreen, but also checking your skin every couple of months. And then finally, by having a dermatologist check every 6 months to a year, depending on your history, to pick up cancers early. The key is picking up cancerous growths on the skin early so that they can be removed completely and decrease the risk of further invasion into the skin and or spreading through the blood vessels, through the nerves, through the lymphatic system to distant sites of the body, which in that situation of metastasis significantly decreases survival and increases risk of bad outcomes. So to summarize, 3 main types of skin cancers: the basal cell, the squamous cell, as well as the melanoma skin cancers, are common on the skin and can be best detected when seen early through vigilance or skin checks at home and with the dermatologist. They can also be mitigated by daily use of mineral sunscreens, or frankly, any sunscreen is better than no sunscreen, but I prefer mineral sunscreens because they're physical blockers of the ultraviolet light. Reapply when you're out for prolonged periods of time in the sun. Don't forget, early detection is key. You may not be able to change your childhood exposures, your youthful exposures of sunscreen. However, you can mitigate your risk of having a severe skin cancer experience by catching them early. So this is one of the reasons I wrote the children's book, Skintacular Facts, to educate children and adults about the skin structure, function, and ways to care for their skin to minimize bad outcomes over their lifetime, including premature aging and skin cancer formation. You may pick up a copy at Amazon.com. It is also available in Spanish. Thank you very much for watching this video. I hope you've learned a little bit more about the different common skin cancers that are seen by dermatologists. Comment below if you've ever had a skin cancer diagnosis, if you've ever had a biopsy, or if you have any questions about skin cancer risks or features. Thank you very much for watching this video. Please subscribe to this channel, click on the notification bell as well as the like button, And leave a comment below, as I described earlier, if you've ever had a skin cancer or biopsy, or just have any questions about what I discussed. You're all fundamentally awesome. I hope you have a wonderful day, and God bless.